We were talking about this earlier, and there's obviously some degree of fear, concern that maybe there's something out there that we didn't pick up in the trials. You know, this vaccine appears to be very safe and very effective based on the science and based on the trials done by Pfizer, the Pfizer vaccine. So the question is, could there be something out there that you didn't pick up when you did a trial with 40,000 people, but you might pick up when you give it to 200 million people? I guess that possibility is out there. It seems unlikely, but that possibility is out there. But I know what COVID does. I know what COVID-19 does. I've seen it. COVID-19 is a virus that can kill 300,000 Americans in 9 months. 9 months, you know, this calendar year. And so, to me, it's very simple math. You know, if you want something to be concerned about and to get upset over, be upset about the death that we've seen. Be upset about what Ricardo and I have seen, our whole staff at EAMC over this year. So I understand that people have fear about the unknown, and that's, you know, that's legitimate. But I think we have to look at it objectively and consider what our goals are. And we're not, you know, we've been waiting for this thing to go away. I mean, if you're going back to March and April, there was a lot of hope. Well, maybe when it warms up, it'll get better. It'll go away, you know. And then we had our July peak. It was worse than April. Well, maybe over time it'll become less virulent. Maybe over time it won't spread as fast. We haven't seen any of those things. Just each peak's been worse than the last, and we're still not any closer to being done with this. And so when Ricardo said this is a light at the end of the tunnel, I think a lot of us feel that way. And maybe this is the beginning of the end. And so I would encourage people to look at things objectively and consider that this might be our way out.
Like you said, this has been maybe a long time coming, and you guys have seen things at the hospital because of this disease that really you should never have had to have seen. So what does it mean to you to get this vaccine now?
Well, it feels like maybe there's hope. Maybe we can stop doing all of this, you know, go into room after room, see people struggling to breathe, watching people, you know, take their last breath, sometimes not with any family around because their family is sick, you know, and you know, seeing how hard our team is working sometimes on these patients that we know just are going to get better, and so yeah, I think it's hope for us.
Do you hope that the public seeing y'all get this vaccine will ease their fears a bit?
I hope so, because, you know, I know if I'm telling you that I want you to get a vaccine and I'm not willing to get it done myself, well, that doesn't say very much for my credibility, does it? So, yeah, you got to be willing to put your money where your mouth is. If you think that this is the way out, then I want to be near the front of the line.
Can you say how many doses the hospital received from ADPH?
I don't know that number offhand. Do you know that number?
2,000.
2,000.
On a similar vein, how long do you anticipate it to take to get all the frontline workers and all the healthcare workers that have come in contact with COVID when he was vaccinated?
Well, our first, you know, our first set of people that were vaccinated are people who have spent more than 25% of their time in direct patient care. And so we're hoping to get all of those people vaccinated within the next couple of weeks, and then we'll take it out from there. I don't know the specific timetable beyond that. And some of it will depend on how quickly we get more vaccine in. A lot of that's controlled by the state at this point. And so as we get more, we'll begin to branch out and get, you know, those who work in healthcare but aren't in direct patient care, and then ultimately those who are high-risk patients, and it goes from there.
Yeah, I meant to, I guess patients in nursing homes were also on the priority list.
Right.
How are they being vaccinated in this process?
The vaccination of the nursing homes is being handled through some of the pharmacy companies. I think it's Walgreens and CVS, right?
Yeah, and ADPH.
And ADPH. So it's handled a different route than us in the hospital. our vaccines here at this time are for our healthcare workers.
Okay.
How do you feel, not just as a medical professional, but as a father, a son, a brother, forgive me, I'm assuming, but to be one of the first people in your community to get this vaccine?
Yeah, one of the arguments against getting the vaccine that I hear is, well, I'm low risk. I'm not likely to get very sick, and I'm fairly low risk. I'm not likely to get very sick from COVID-19, but I still have the capacity to spread it. And we are seeing spread within families, and so to really shut this thing down, it can't just be people who are high risk themselves, but people who come in contact with people who are high risk, which pretty much gets all of us. And so that for me to get the vaccine is me recognizing, okay, I might not get sick, but this might keep me from spreading it to somebody, to my patients or to my family who has much higher risk for having severe disease.
So y'all got 2,000 doses yesterday. Do you know how many employees have been vaccinated so far? No numbers on that?
Yeah, it's a steady stream.
Okay.
Yeah, but it's gonna take a while because we can only do so many in a certain amount of time, so. I wanted to ask, so just so y'all know, we're at 62 patients today, which equals our peak back in July 22nd of 62. So what I wanted to ask is, the vaccine's great, but it's not gonna change our hospitalizations overnight or even probably next month. I mean, it's a long-term
That's right.
thing, whereas, so speak to what the public needs to do in addition to getting their flu shot or their vaccine shot right now.
Yeah, well, as Ricardo says, it's not time to stop the things that we know and that we've already put into place to try to help limit the spread of COVID-19. So it's not time to stop wearing a mask. It's not time to stop social distancing. It's not time to stop avoiding crowds, even in your family gatherings. And this is one of the hardest things around Thanksgiving and Christmas. This peak is in part due to Thanksgiving gatherings, and you can spread it to your family members who you've been in and out of close contact with. And so all of the same precautions that we've been preaching since March are still in play. And this is a long term. This is hopefully the beginning of the end, but we are still months and months away from a point where we have herd immunity or where we can really begin to shut down the transmission of COVID-19.